Hello, this is Dr. Bhatti, and today I'm going to answer a question which I have been asked 3 times in the past 1 week, so I thought it is important to address this issue. The question is, Doctor, how much time before my hair transplant should I stop finasteride? Well, as you all know, finasteride is a DHT blocker, and many patients take it for thinning hair. Some patients take it for improving the donor area, and this I have addressed in a previous video in which I have said that you should not take finasteride to improve the donor because it gives a fallacious impression that all is good, and even catagen hair which are going away, miniaturizing, become robust and look like anagen hair. And these are the hair which, when we stop finasteride 6 months post a hair transplant, will continue to miniaturize, and therefore they will spoil the eventual result. So since in my technique, anagen Q+ technique, I am aiming only at harvesting anagen grafts which are not made to look like anagen hair by taking finasteride. So I advise my patients that they should stop finasteride about 4 to 6 weeks before their hair transplant, because it takes about 4 to 6 weeks for the miniaturized hair which have been made robust, which have been made to look like anagen hair, to go back to the previous state, and which can be made out by magnification. The other question asked by a patient of mine who's preparing himself for a hair transplant at Darlingbird's clinic. He was started by another clinic on finasteride 1 month back, and his procedure is scheduled to be in the last week of December, that is 6 weeks from now. This patient had just been started on finasteride 1 month back, so he's gone through the entire shedding period. So he wanted to know whether he should stop the finasteride for a little longer, wait for his hair transplant to be done the next year, that is after 3 months. Well, no. The effect of finasteride only comes after 3 months, because it is only after 3 months that the root displaces the old hair, the old miniaturized hair, and this process is called shedding, and a new hair which looks like anagen hair, it forms and appears on the surface not before 3 months are over. So since this patient has been taking finasteride for only 1 month, he should stop it immediately, because the effects of finasteride are not yet obvious. And there is no point continuing finasteride when you are just about 6 weeks away from a hair transplant. Yes, after the mandatory period of 6 months is over, it is his free choice, his free will to continue finasteride, to continue taking finasteride for a much longer period to maintain his thinning hair. In the end, take-home message is that I do not recommend finasteride to improve the quality of your scalp donor unless you are committed to take finasteride for the rest of the period of your life, as long as you value your hair. So if that is not your plan, I will discourage you from taking finasteride before a hair transplant. Well, if you have been taking finasteride before a hair transplant, stop it at least 4 to 6 weeks before the procedure. That was an important message because a lot of queries from patients. If you liked the video, please let me know. And if you have further questions, do not forget to write in the comment section below. Again, it is a pleasure having you here on my channel. Thank you very much.